Some of the people I know say that the brain is the last black box organ in the body. We don't fully understand how it works. We don't fully understand some of the biological changes that take place over time, or even how some disease progression starts. So a lot of work has been done over the years to try to identify and characterize these changes. So one way of characterizing changes is called morphology. So that's when something changes in shape and structure. Morphology is often, say blood vessels get bigger or parts of the brain shrink, that type of thing. There's specific techniques, some of them related to diffusion imaging, to measure morphology, and not even just the structure itself, but also how the organization of the nerves within the brain also change as the brain changes shape. So that's one way of looking at things. It's not entirely satisfactory because, again, you have to look at a lot of people that have similar changes over the course of a disease in order to get good morphology to characterize. So you use a number of subjects that have similar changes and then try to extrapolate what those changes mean to specific diseases. Another common way to do it is to use contrast agents. The most popular, or the most common used one, is gadolinium, but the issue with gadolinium is it's highly toxic, and it's difficult for the body to clear it if it's ever been introduced. The use of gadolinium has been discouraged for a number of years now. So one alternative to an injected contrast agent is called arterial spin labeling. So arterial spin labeling actually uses the magnetic properties of iron in the blood, and so you can excite the blood in the neck, and then as the blood flows from the neck into the brain, you can use that excited blood to characterize how the blood is flowing through the brain. This is a great technique in the sense that non-invasive, but the resolution of the blood images that are given back is actually quite low. And there's been a lot of work on that, some of it from some good friends of mine that have advanced that, but it's still not at the level where individual diagnosis or individual characterization of disease progression can occur at using ASL. And that's the distinction of where Imaginostics comes in, is Imaginostics is using a contrast agent that is much better tolerated by the human body. It provides contrast that's sharp enough to enable individual imaging to provide diagnostic image quality from a single scan.